I had an argument with the 10-year plan team and a bit with Wes about something I wanted them to say more explicitly in the plan and wish they didn't. And indeed, I spoke to Wes about this the other day, and at last plea, I said, look, as you launch it, could you say this? And what I wanted him to say was how important patients and the public will be to the delivery of this plan, that patient attitudes, patient behaviors, patient expectations, the willingness of patients to do things differently are really critical. The story here, I think, is at the beginning of the 10-year plan process, they did some focus groups in which they said to people, do you think part of this is about you taking on more responsibility? And the people out them said, no, sod off, it's about you providing better services. Now, I kind of get that, but I still think we ought to be engaging in all sorts of ways, from, the public being willing to support difficult reconfiguration to using the app, whatever it might be. When I spoke to Wes about this the other day, he said, look, Matthew, if you want to make unpopular arguments to the public, you go for it, mate. We will carry on saying that. Sam, how important do you think it is, without, of course, wanting to contradict our Secretary of State, that we have a message here to the public about their importance in achieving the transformation we want to achieve over the next few years?
I think it's really crucial, Matthew. I also have empathy, I guess, for the Secretary of State, that perhaps saying that sort of thing nationally may run the risk of being viewed as the nanny state. And actually, one of the really exciting things about this plan is the devolution, the local decision making. So, in part, I see that as our responsibility at a local level. We know our populations, we can work with our voluntary sector organisations, all of our community partners, local politicians, to be able to have that conversation, which is actually, when we're looking at services and the shape of services in the future, this is what the evidence tells us. Actually, how can we co-produce aspects of this with our population, but also how do we have a conversation with them about what is all of our role in safeguarding an NHS free at the point of delivery for the future? And I think some of the announcements last week around Health Watch, and I mean, we've got brilliant relationships with Health Watch locally. They are really valued. But actually, if we're thinking about the future, we'll have some time now to work with them to think about how do we get a more representative voice. And we're starting to think about citizens' assemblies. We need to have a different, transparent conversation with the public about the opportunities, the challenges, the choices that we need to make. I'm really conscious that every year, as a council taxpayer, I get a bill that arrives on my doormat that tells me what the charges are, what they're for, if I've got a preset for social care. I think we need something similar on health, Matthew. We're spending in our system £1 billion a year at the moment on medication. We've got huge wastage in medication. That's just one of many examples of how the public can work with us to better use the scarce resource that we've got to make the shifts that we need in this plan. So we have to have that conversation, but I think we do that locally.